Hi everyone, I am Dr. Vijay Shetty. I am an eye surgeon. Today I am going to speak to you about the cataract and its treatment. I have done more than 17,000 cataract surgeries so far. This includes regular cataract surgery and also certain cataract surgeries which are difficult to operate in normal situations. This includes something like a small pupil where you have a small aperture to do a cataract surgery, and also in cataracts which has got weaker support, wherein you'll have to do cataract surgery with utmost care and use some kind of support for the capsule to perform the surgery, as well as to put the intraocular lens inside the eye. Normal eye has a lens inside the eye which helps in focusing the rays onto the retina, where the image is formed and it is transmitted through optic nerve to the brain, where image is perceived. The main function of the lens is to focus the image on the retina. Normally this is clear like a glass. However, in cataract it becomes little cloudy, and that means it cannot transmit light as good as a clear lens. Hence the vision becomes blurred in cataract. The cataract evolves in various stages. Like it depends on the type of cataract as well. Like it could be cortical cataract, nuclear sclerosis cataract, or it could be posterior subcapsular cataract. The most common is nuclear sclerosis cataract, which evolves from stage 1 to stage 5. So this is a normal aging process and continues with aging. So the cataract surgery can be done at any stage of this cataract. The indication for doing a surgery is when this cataract affects the normal activity of the person. Cataract can present with various symptoms, the most common being unclear vision or blurred vision. In the beginning, the quality of vision is compromised and the night vision is affected. So for example, if somebody is into night driving who have to look at the headlights, then the light spreads when there is a headlight in front of you, and there will be because of the glare, there will be difficulty in doing the night driving. And the second most common is difficulty in reading. So people are into reading, mobile use or the computer use. They perceive it earlier when they develop early cataract, because these activities get affected first in early cataracts. And if this is not noticed by the person in the beginning, then it continues to have increase, and then the person will have blurred vision, which affects distance as well as near. Occasionally the person can have double vision or multiple vision with cataract, but this is a rare symptom. But most often the complaint is blurred vision. Now to tell you one interesting fact about cataract, 80% of the blurred vision or the vision loss in India is because of cataract. So cataract is the leading cause of preventable blindness in India. There are various causes for cataract, the most common cause being the advancing age. So everybody tends to have cataract at one or the other age. However, it is most common after the age of 50 to 60 years, and the incidence keeps increasing with advancing age. However, there are other causes for cataract, which includes diabetes, injury to the eye, and certain diseases of the eye like uveitis. So occasionally the cataract can be seen at birth as well. These are called congenital cataract, but these are rare situations. Cataract diagnosis is basically by the symptoms and the signs that the patient presents with. The most common complaint that the patient presents with cataract is blurred vision or hazy vision. So on examination, once the patient approaches the eye surgeon checks the vision on the chart and then notices whether there is any drop in vision. Further, the eye is examined under the microscope to see whether there is any haziness or opacity in the lens of the eye. This is done under an instrument called slit lamp biomicroscope. Ideally, we need to dilate the pupil with a drop to examine the eye completely for the presence of cataract. The age-related cataract cannot be reversed or prevented. However, the cataract caused by other diseases like diabetes and uveitis can be prevented. However, the cataract due to whatever cause cannot be reversed in most of the cases.